like to show you how to use a spacer with your inhaler. This spacer right here is called an AeroChamber. It has a oblong mouthpiece. It has a donut-shaped one-way valve called a flap. And this spacer would be used for someone probably around the age of 7 or up. Another type of spacer that you might see is called an Optichamber. This spacer is just a little different. It has a round mouthpiece, and the one-way valve is more of a flap, but more of in a cross shape. The difference with this one is that there's a mask that can also fit on this one. And this spacer would be used also for children probably around the ages of 7 or up without the mask. And with the mask you could even use for infants. Another type of spacer you may see is a spacer with a mask. There's 3 different sizes of mask. This is a medium mask. This mask is actually attached to the spacer. It cannot be removed. And it has a different type of flap. There's a flap right here that will move in and out as the patient breathes. And this spacer can be used for younger children. Can be even used to maybe age 1 and up. Under 1, you may want to use the spacer that has a little bit smaller mask, which would be orange. You're looking for spacers, if you do have a choice, is to make sure you're looking for some that have the one-way valve. There are some spacers out there that do not have a valve. You want to make sure they have a valve so that they're able to hold the medication and then take a slow, deep breath in to get the medication in, and not just a piece of plastic that has extra space in there. I'm going to show you how to use a spacer with your inhaler. The reason that we use the spacer is because when you take your inhaler and you spray this, the puff will come out quite a ways. So we want to get the medicine to your lungs and not to the back of your throat. In order to do that, we use a spacer, which is actually called a holding chamber. So you'll hold the medicine in here. It gives you a chance to then take a slow, deep breath to get the medication to your lungs. So the technique is shake the inhaler, put it in the back, just like there. Take this cap off. You'll want to blow your air out, put your mouth on there, squirt, take a slow, deep breath in, and then hold your breath for 10 seconds. And the reason I have you blow your air out first is so that you empty your lungs, so that the next step is just to take a slow, deep breath in. So if you already start here and take a breath in, you're not able to take a real deep breath. And so that's why I want you to empty your lungs. So why don't you stand up and show me how to use this inhaler with this spacer. Okay, and the first thing we always want to do is to shake the inhaler, and then blow your air out, and put that in your mouth. You'll want to squirt it. Slow, deep breath in, and then hold your breath for 10 seconds. 6, 7, 8, 9, 10, and then you can let out. Okay, and as you're breathing in, this one-way valve that looks kind of a donut shape is actually moving towards you, and so that will tell you if someone was watching you do this, they would know that that flap was moving and be able to tell that you're getting the medication in. Okay, so this is one type of a spacer. It's called an AeroChamber. There's another type of spacer that's called an Optichamber. It's just a little different. The mouthpiece is a little bit different shaped. This one-way valve is a little bit different shaped. Instead of donut shaped, it has some flaps that kind of cross in the middle. They're a little bit easier to see the flaps move, but it's still the same technique. You want to shake the inhaler, place it in the back, blow your air out, put that in your mouth, squirt, take a slow deep breath in, and hold your breath for 10 seconds. Okay, so why don't you try to use this technique. Shake the inhaler and blow your air out and put that in your mouth. You'll want to squirt, slow deep breath in and hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now one thing when you're breathing in like that, if you're going in too hard, you're going to hear a whistle sound. So why don't you show me what the whistle sound would sound like? Just take a breath in and, right. So that would tell you that you're going in too hard, which would be the same thing where your medicine's just going to hit the back of your throat and you'll swallow it and it does not get into your lungs. This is a medicine that has to be into your lungs in order to work. Okay? Very good. The last type of spacer would be used for kids that are younger, that were not able to coordinate how to use the spacer that I just showed you how to use. Generally those spacers you can use up to about age 7, they're able to use those. Up to that point, this type is just a little bit easier to use. It's the same technique. You want to shake the inhaler. You always want to shake the inhaler before each puff. It just fits in the back. This part would go over the nose and the mouth. You want to make sure it goes over and fits firmly around the nose and the mouth so that it's not, make sure that it's not underneath the chin. And the reason is that we need a good seal so that we can get this flap to move. The same, it's a one-way valve, and this one will tell you as they exhale, so that will tell you that they're taking breaths in and out. You want to actually count that. So you would shake this inhaler, put that over the nose and the mouth, and then squirt and watch that flap move 6 times. Okay? So some of the problems with using these spacers is that if you're not using it properly, you're not getting the medicine to your lungs. And so when teaching people how to use spacers, you want to make sure that like I said, as you exhale first, that just allows you to now take a nice deep breath in. Some kids I'll notice is they take a breath in. Here, excuse me, let me show you. They start to take their breath, they take a breath in and then put it in their mouth and squirt, and now there's no room to actually take a big breath in. Okay, so that's one thing you'll want to watch for. Another thing is sometimes they'll breathe through their nose, so looks like they're taking a nice deep breath in, but they're not getting any of the medication. It has to come through the spacer. Like we talked about, as you go in too fast, that's another way that they're not getting the medication. There's lots of ways to do it wrong, and there's only one way to do it right. So it's very important to make sure you learn how to do this properly to make sure you're getting your medication. So do you have any questions about the spacer or the inhalers?
So are the spacers only for teenagers, young people, or adults as well?
That's a very good question. These spacers we recommend even for adults. We talked about how the medication has to get to the lungs to work, and when you spray the inhaler, it comes out very far. It also comes out very fast, so there's no way for you to actually inhale hard enough or fast enough to get the medication into your lungs. So most of it ends up on the back of your throat. So even for adults, we recommend spacers every time they use their medication.
So am I really going to have to carry this around? It looks pretty cumbersome.
That's a good point. With this spacer, it is kind of cumbersome, but when you're having to use medication every day, you'll use an inhaled corticosteroid, and that medicine, you can keep this spacer at home. So that medication is actually the most important medication, and so if you're getting that medication every day, the need for a rescue inhaler is less. There are several things that you can do. If you're going to school, you have a backpack, you could keep it in the backpack. But if you're out, say, playing with your friends, some kids we've noticed will put it in their sock, keep it in the sock. But if you really don't want to carry it, you can just carry the inhaler. But just to remember that it is only to be the rescue medicine and to be used if you need rescued. One thing you can do is, if you know you're going to go out, say you have football practice, is to use the inhaler before you go. The medication lasts for 4 hours, so you generally should be covered. There is one technique you can use if you're just unable to bring the spacer with you. It's not quite as effective, but with the rescue medicine, it's not as important to use the spacer. And that technique is to shake the inhaler. You want to empty your lungs, put this in your mouth, and just start to breathe in. And then as you start to breathe in, you'll squirt and finish breathing in, and then hold your breath for the 10 seconds as well. It's a little bit different technique. It's not as good as using it with the spacer, but in an emergency, it can be used. Do you have any more questions?
I don't think so. That should be it.
All right, thank you.
Thank you.